Welcome to Chat and Shit, the podcast that's technically about gut health, but who knows what pan the chat led up in.
I'm Alana.
And I'm Lisa.
We're here to bring a celeb mate to grill our gut health experts, and nothing is off limits.
From DJs to founders of the gut stuff, we've seen it all. Gut health is complicated and it's super personal, but that doesn't mean it has to be boring.
Gut health is serious shit. It's linked to everything from your mental health to your immune system and way beyond.
Everyone's banging on about gut health now, but don't worry, this is your one-stop shop for gut facts,
Real talk,
and enough laughs to make your belly work overtime.
Let's get into it.
So on today's episode, we're going to be shining a light on menopause and probably a lot of other things. Menopause is an often misunderstood stage of every woman's life. Joining us is the brilliant Dr. Katie Armstrong, Denim twins today, founder of Clinic 51 and an NHS GP for over 20 years. Katie is a specialist in women's health and menopause care and passionate about helping women feel empowered, informed and in control of their hormones. And asking the big and often unspoken questions is a wonderful Hilary Whitehall, actress, photographer, mother, grandmother and co-host of the Whittering Whitehalls. You may know her from Travels with My Father and Celebrity Gogglebox, but today she's in a different role to share her own experiences and get all the answers we need. And Hilary is the most prepped guest we've ever had.
The best.
There's highlights, there's highlight areas. Yeah.
I mean, I am such a schoolgirl because I love a highlighter and I love a list. Yeah.
And it's all in different sections
I
as
know,
well.
and I've colour coordinated it. So my mother's in pink, general topics blue, children yellow, Michael green. There we go.
Are you ready for this, Katie?
I am.
Yes.
I didn't get the denim email, sorry.
Yeah.
Oh. We're sort of matched
sort of
with
matched.
this muted green.
Oh.
Thing.
Yes, I'm on brand.
Yeah, you are. So are the boots. I don't know if you're there.
Pink,
Shot.
pink boot.
Right, Hilary, the moment
Yes.
of truth.
I
the
know.
best test you've ever done in your life.
A little bit nervous.
The Activia Gut Health Tracker. I
Yeah.
think you're going to nail this.
So
I'm
did
loving
I,
that
actually.
green, actually.
Yeah.
That's very me, that green.
Yeah.
Yeah.
Right, diet. Right, here
Right,
she
here we
goes.
go. Diet. How many portions of fruit do you eat? Yeah.
0 to
What's your
1 per
go-to?
week,
Oh.
or 2 or more.
What?
Oh, yes.
Portions?
Oh,
Yeah, you go way more than that.
Yeah, well, I'm not that keen on fruit, weirdly. We'll come back to that. Vegetables, we love a veg.
Oh,
7 or more.
Yeah,
Oh,
definitely.
yeah, top of the
Nuts
class.
and seeds, 2 to 5.
Okay.
Okay, how many portions of legume? I quite like a legume.
1 to 3 per
Chickpea
week.
fan.
In the middle.
I love a bean.
Do you?
Yeah. I like a bit of fermented.
Fermented foods 2 to 4 times per week.
Yeah.
Every day.
Alcohol.
How often
drink
do you drink
alcohol.
alcohol?
Well, I've given it up.
Have
Have
you?
you?
Yeah, so I would say less than once a month.
Yeah,
How you feeling?
absolutely.
How you feeling after the bed?
Bored.
Oh,
Yeah.
It's so
I
boring, isn't
mean,
it?
the thing is, my husband is 85, and I thought, okay, I just need to be on it, a bit more on it, I think. So I then thought, well, let's just give it up.
Yeah.
But
Feel like it's going to be a
I've
long-lasting
I've
thing, or no?
Well, I've had the odd glass of champagne, which, interestingly, I now don't finish the glass.
It's funny how it does turn your
Yeah, I
taste
just
buds
sort of
off a
think
little bit.
it's
Yeah, why?
nice, but I don't need any more.
I don't think I've never not finished a drink
Me
in my
neither.
life.
Me neither.
Yeah, well, I just thought, let's give it a go. So July, I gave it up in July.
You're not nearly a year.
But, then you have to weigh out. I love a non-alcoholic cocktail, and you look at what's in them, and you think,
They're just
Well, no, it's
expensive.
just orange juice and you're paying £6.50 for the
I know,
privilege.
yeah.
How often do you consume red meat?
I would say probably once a
Once
week.
a week.
Yeah.
That's what I put as well.
Exercise.
Exercise.
Okay, here
I
we
think
go.
you're going to be good at this as well.
How often do you pass on moderate cardio? I would say that.
50 to 150
Yeah.
minutes a week.
Yeah.
Cardio.
How often
Do you stretch and mobility
I
exercise?
would say
You like a bit of yoga?
I don't like yoga. It's far too passive for me. I do.
Towards a HIIT class.
What do? I do a PT session.
Oh, right, amazing.
At the moment, twice a week.
So stretching 2 more times a week.
Yeah, a lot of weights.
Sat still at the telly.
Less than 8 hours per day, definitely.
When you were doing Gogglebox, did you have to sit loads at the telly?
I've only done Celebrity Gogglebox for
And that's
Stand Up to
shorter,
Cancer once.
okay.
Yeah. So I've got friends who do it.
My favourite Gogglebox moment involves you getting in the sauna. That honestly, TV gold. I laughed for
Oh my God.
24 hours.
I know. The things I do. The things I do for
I
that
was-
child.
And it was, honestly, I could not stop laughing. It was one of the best moments of telly I've ever witnessed.
I love you. I mean, my role in life is to embarrass Jack.
Yeah.
Well, embarrass all
But
my
it's just
children.
you just assumed that that's obviously what you did. So and Jack was like, she's not. But fair play, because it was bloody hot. It looked hot.
I have never known heat like it.
Yeah,
It was unbelievable. And we were in there for over an hour. It was a nightmare with these very strange people.
How long does it
Middle
take
of
you to
traffic.
fall asleep?
Oh,
More than
sleep is
30
my
minutes?
big problem.
Oh, I was asleep 5 to 7 hours.
All right. Do you go to sleep and wake up at the same time every day?
No, it varies. Stress.
Right,
She
here we
goes.
go.
Here we go.
Strap in.
Have you been stressed in the last month? I mean, in the last hour?
Will it disrupt your daily life?
Yes, of course I have. Yeah. Do you feel you have experienced many traumatic events in your life? I mean, I would
sauna
say
one?
yes. Yep.
You brought up 3 kids, so it's...
Yeah.
Exactly. And now grandchildren. Have you taken
Antibiotics?
No,
No.
in the last 2 months. No.
Do you smoke?
Nope.
Nope.
Do you have any pets? Yes.
Like doggies.
Doggy.
Doggies.
How often do you suffer from
I
gut
mean, I
upset?
don't really.
Less than once a month?
Yeah.
She's nailed it.
We've got really similar answers.
How often are you unwell? I would say that's a tricky one. I would say occasionally, but it's frequently to occasionally because of the grandchildren.
Yeah.
So I'm
I've
going to
got
go for that
occasionally.
one.
That.
Yeah.
Right.
There we go.
Here we go.
See
So
results.
So results. I know what they're going to be.
50%.
50%.
Do you know what? I think your diet and exercise.
Look,
It's
diet,
perfect.
75%.
Yeah.
Exercise,
Sleep,
87%.
terrible. I knew
7%.
that.
And
Stress.
0.
0%.
Yeah. So just to let you know, Jack gave me this for my birthday last week. And I,
Happy
for the
birthday.
first time ever, wore it last night to track my sleep, just to try and get an idea of what's going on with my sleep, which
Yeah.
is postmenopausally. Terrible.
I thought it'd be quite good to just cover off the basics so we're all on the same level about, what is menopause, perimenopause, postmenopause, because there's a lot of different stages, isn't there?
There is, and I think that we tend to use catch-all phrases, don't we? So actually, if we think about what menopause is, the word itself tells you what it is. So meno, period, pause, stop. So menopause is actually just one day when you stop your periods. But I think we use this catch-all term to talk about the whole time when your ovaries are shutting down. So perimenopause is from the start of hormonal change as your ovaries shut down. And that can happen for 10 to 15 years before your periods actually stop. So we're talking for most women late 30s, early 40s, when they may first begin to experience
Early,
symptoms.
isn't it?
And then post-menopause, well, that's when our ovaries have shut down and our hormones at that stage are stable, but they are, when I say hormones, we're talking female hormones, but they're low. And so that's from the point where you've had your last period onwards. Very interestingly, though, your ovaries don't actually run out of eggs for about 2 years until after your period stops.
Interesting.
So we'll come on and talk in a bit more detail about what that means for your hormones changing. But yeah, it's a big transition in a woman's life.
And we go through a lot as women, don't we? Like, I guess, and we'll probably get on to this, like our gut health is so closely linked to our hormones. And we are constantly on this journey. We live in this cyclical world and we're stretched out into a linear patriarchal world. When as women, we have all this to contend with. Did you notice, Hilary, when you were starting to go through menopause?
Well, no, I actually had a coil fitted at the time.
Yeah.
It was, what's it called? A
Mirena
Mirena.
coil,
Yeah,
yeah.
yeah. So I was blissfully unaware of the whole
Yeah.
thing. And then ultimately the GP said, I think we'll maybe take that out now. But I have to say, I've been very, very lucky. And I did not need the services of Davina McCall and her wonderful work that she's done to highlight all of this. Because I barely noticed. I've only got one big, I would say, postmenopausal problem, and that is sleep.
Yeah.
Which I've never got back.
Yeah.
I could sleep anywhere, anytime for days. Now I can't sleep.
And I think that that's one of the very interesting thing about hormones, because we tend to think about menopause being hot flushes and mood swings, don't we? But actually, we have hormone receptors on almost every cell of the female body. And that's because the hormones that our ovaries produce are reproductive hormones. So they're there to prepare us for pregnancy, they're there to keep us pregnant, but they're also there to keep us fit, healthy and strong enough to have children. So when our hormones change, they have the power to affect almost anything and everything in our body. And sleep is something, if I think about why people come and see me in my clinic, most people can not nice, but can cope with a hot flush. But dealing with problem sleep, dealing with anxiety, dealing with brain fog, these are all very common symptoms of menopause. And I think these are the things that perhaps we don't talk about enough. I think there's also this kind of, particularly when you go and see your GP, a bit of a this focus on, well, what's your cycle doing? And actually, whilst one of the key things with menopause is that you'll notice that you might have cyclical symptoms. Many women are going to be on contraceptives, whether it's the coil or the combined pill or the progesterone-only pill, and won't have a cycle. You can be having a regular cycle and still be in the early stages of your ovaries shutting down, and can be having symptoms that you are just putting down to life stress, but actually are hormones. It is a really, really huge change. I would say it's a bit like having 10 tabs open on your computer whilst you're trying to do a piece of work. It's like having a flickering light bulb in the background when you're trying to concentrate. It takes up bandwidth. And so everything might just be that bit harder. But for some women, actually, no problem at all. So we're all very, very different. And again, I think that kind of trying to fit us all into one basket. And you were right as well, trying to say that, perimenopause and menopause is a huge hormonal change. It's a roller coaster. But actually, throughout women's reproductive lives, our hormones are not stable. Every month we cycle, and that affects how we turn up every day. And yet we are in a world where we are expected to turn up consistently and to do everything consistently. And that's just not how our bodies actually work.
I am starting to panic now that when you're saying it can be in your late 30s, because we're 37 tomorrow.
I thought we were 38 tomorrow, but
I think we're 37.
I
actually asked Lisa. Lisa's going to do her. So Lisa's at uni just now doing like executive MBA basically, and tomorrow she's in Birmingham doing a presentation thing. And we've never had a birthday apart from in COVID. So I said, well, I'll come up to Birmingham and let's go out for dinner. And she was like, oh, I'm actually going out with my uni mates.
No, I didn't say I'm going to. It's a dinner that they're putting on in Birmingham Museum where I'm doing the headline speech, so I need to be there. And I can't just get you an invite. You're not a student. You're not doing the MBA.
Oh,
honestly,
harsh.
Quite
harsh.
Harsh to it.
And what were we going to say?
No, I was going to say also, just listening to you talk there, I probably attributed things not to menopause, because that's the other thing that we do. I mean, I have a few joint issues, which I put down to playing sport to quite a high level up until the age of 57 when I got injured. Now, I think probably a lot of my joint problems have stemmed from menopause, which I put down to sport.
Yeah,
Estrogen.
Estrogen. So ovaries produce 3 hormones: estrogen, progesterone, testosterone. Estrogen is kind of like the most important hormone for women. And it does many different roles, but estrogen is an anti-inflammatory. So estrogen is like our body's natural Nurofen. It just helps everything hurt less. It helps hyaluronic acid, which is this brilliant like kind of oil in our joints and in our soft tissues. So many women may literally feel like they've aged overnight, like they suddenly feel like they're 80, not 50. Lots more injuries, and it is because our muscles and joints are different without estrogen. I had a really good friend and colleague, a GP, and she was like, I can deal with this menopause thing as long as I only see 4 patients in a row and I stretch for 20 minutes in between each 4 patients. But it's okay because I've adjusted my surgery to be able to cope with that. But I'm fine. I think we put up with a lot as women. We're used to multitasking, juggling, putting ourselves way down the list. We're also used to going to the doctor with single problems. So we don't look at everything together. So whilst for some women it may be 1 or 2 huge symptoms, for most women it's a little bit of lots. And each little bit is you can kind of cope with. But you put it all together, often on top of having children and often teenagers or maybe younger children. I mean, when I was going through my menopause, I had a toddler.
Wow.
And you're normally doing relatively, big work in that time of your life. Might have aging parents, all of that together. It's an interesting mix.
And estrogen is linked to your gut microbiome as well, isn't
It
it?
certainly is, yeah.
What is the link between
Is it
our
called the
microbes?
estrobolome?
It is
Estrobolome.
called, or say that again.
In a Scottish accent, estrobolome.
So we've known for a long time that our gut is sensitive to hormones. So any woman will tell you that just before their period, they
Period
might be
poos.
one of their signs. So it isn't a big surprise for us to find out that there is a part of our microbiome that is very affected by our hormones, and interestingly actually has the power to control our hormones as well. So if we look after our gut microbiome, potentially we can help to slightly flatten the curve of our hormone fluctuations. So, like all bits of our body, I think thinking about things in isolation is really dangerous. We want to think about things together, and looking after your gut microbiome is going to help your mental health. It's going to help your hormonal health. So a fascinating area, and I'm really interested that it's one of those new areas of medicine that you kind of go, oh, what are we going to find out next about this, and what are we going to find out about how we might use it as part of menopause treatment?
How aware are you of the gut microbiome?
As my stomach rumbles, it's saying yes.
It's like, ta-da!
Well, I can't say that it's something I focus on particularly, but then I'm very focused on nutrition. I like to cook. I like to cook properly. When the kids were little, I would, home make a pizza or fish fingers or whatever rather than buying them. I taught all my children to cook. They're far better cooks than I am. They all cook from scratch. We don't have many takeaways. We do go out to restaurants a lot, which is lovely, and we're very spoiled that we do that. So I tend to come at it from a slightly different angle, and obviously exercise as well is very important to me. But I've struggled with my weight all my life, so I'm very aware of the effects of not looking after your gut biome. And coming back to menopause, of course, that's the other big side effect is, those days when you could not eat for 2 days and lose a couple of pounds, can't do that post-menopausally.
No, and I think, again, it's easy, isn't it, to look on social media and just think this very simple equation of calories in and energy expenditure, and that actually just isn't true about how our bodies work. And that, I think, for most women becomes really apparent at menopause. Menopause is a time of huge metabolic change as well. We change where we lay down fat, so suddenly we go from peripheral fat, sort of bums and thighs and boobs, so an hourglass figure, to a male pattern fat distribution, so central fat. And of course, it's that central fat that is the fat that's around our organs that the body finds hardest to deal with, and is linked to diabetes, is linked to metabolic problems and heart disease. So that changes as our hormones change. Estrogen and insulin are also very closely linked, so that as estrogen falls, we become more resistant to insulin. So we find it harder to control our blood sugars. Estrogen also affects how cortisol works, and cortisol's our sort of stress hormone. And as estrogen drops, we become more sensitive to cortisol. Cortisol in return is really important in terms of looking after our metabolic rate, because when we were in the cave and there was a saber-toothed tiger outside, our bodies went, oh, cortisol means we store central weight because that's going to keep us safe if we can't leave the cave. Well, of course, that's not what we need in modern day society, but our body doesn't know that. So there are many very real changes, meaning that the average woman is going to put on between 5 to 10 kilos over that 10 years of menopause. She's not doing anything different. She's not lying to the doctor about what she doesn't eat. It is a change in her body. And some of that change, because again, our ancestors would have done much better with a little extra fat on them as they were getting older. It meant that you were going to be better able to withstand diseases and famines.
And cold.
Exactly that. So real metabolic change. And of course, nowadays, in times of abundance, we know that obesity is linked to many other health conditions. So all of these things for us as women are intrinsically linked, but the things we used to do don't work anymore. We need to work with our metabolism in a different way.
I've always I've got lots of friends on HRT who swear by it. I've always been very resistant to it. One, because I didn't feel I had that many symptoms, but also I hate the idea of taking something forevermore.
Yeah.
I mean, I have to weigh up whether I'm taking a Panadol, to be honest. I don't like taking pills.
Yeah, well, should we touch on HRT?
Yeah,
'Cause
let's
it's
talk about HRT.
It's almost become like trendy in a way, hasn't it?
Well, I think we've gone, and I think life often goes like this. We've gone from one end of the pendulum to the other, haven't we? So 25 years ago, we had the Women's Health Initiative study published that essentially was a great study, but the headlines and the reporting of it were very sensationalist. So we got told that HRT was going to give you breast cancer, and I think our brains then went, oh, that must mean it's going to kill you. Overnight, we saw HRT prescribing just go through the floor. Women just stopped taking HRT. With that, we stopped talking about menopause. And we kind of just told women, well, you know, no point in talking about it, we can't do anything about it. Just got to get on with it.
Yeah.
I think then in the last 5 to 6 years, with people like Davina, suddenly you cannot turn on the telly, listen to a podcast, open a magazine without seeing talk about menopause, or somebody telling you that HRT is the silver bullet, the elixir of life. You know, never felt better since I was on HRT. And I see everyone comes to me going, well, you know, what's the truth? And of course, the truth is completely individual, like it is with all medicines, because HRT does have benefits, but HRT has also got risks.
Excuse my ignorance, but what actually is HRT?
Yeah. So HRT is what it says on the tin. It's hormone replacement therapy. So you're replacing the hormones that your ovaries are no longer producing. So for most women, that will be a combination of estrogen with progesterone. So the important thing there is that if you have a womb, you need both, because estrogen causes the lining of the womb to grow. Progesterone protects the lining of the womb. So one of the things we don't talk about much with HRT is that if you were to take estrogen on your own, you had a womb, you've got an increased risk of womb cancer. So it's really important that if you take HRT, you take it properly, so you protect your womb, because we just think about boobs all the time, don't we? But if we come back to, so HRT for most women, estrogen and progesterone, and you can take that when you're going through the hormone fluctuations. And for some women, they will decide to take it for the rest of your life. But there isn't a, you know, thou must take it for X amount of time. There isn't a, you can't take it before or you can't take it after. It is about individualising it to you. So the benefits of HRT, well, it is incredibly effective at managing symptoms. Not all symptoms, but most symptoms. It's really, really good at managing what we medically call vasomotor symptoms, so hot flushes and night sweats. But as I've already talked about, for many women, they're not the most troublesome symptoms.
It's not going to give Hilary a good night's sleep, is it?
I vaguely remember having a hot flush, maybe half a dozen times, if that.
So 1 in 5 women will never have one.
Yeah.
And of course, every woman's going to go through menopause. I'd say about 1 in 5 women have really troublesome kind of dripping, like awful, waking up in the night, you know, having to have 10 towels by the bed. For most women, they'll notice a temperature change difference, but it's kind of copable with. But undoubtedly, HRT can help with controlling anxiety and mood. It can help some women with sleep. It can very much help with muscle and joint pain. It can help with migraines and headaches. So there are many symptoms that HRT can help with, but it doesn't mean that you will never have any symptoms again. I think we also have to think about the fact that we come into midlife with lots of other things going on. So if we aren't looking after ourselves, or if we're coping with lots of other things, you know, HRT is not going to make you feel any better than you did when your own ovaries were actually working in your 20s and 30s. And there are risks. We've already talked about womb cancer. There is a risk of breast cancer, even with modern HRT. Now, for most women, that risk is relatively small, needs to be taken in the context of benefit. There's a benefit for your long-term health. There's a benefit for your bone health. There's a benefit for your heart health. But actually, that's where the evidence stops. And that largely is because, like most things in women's health, this is such an under-researched area.
I was just about to touch on this. There's a much wider conversation to be had here around, firstly, and because Hilary, I know you were a doula as well, so you'll have seen the full spectrum. But first point of, you know, it's crazy that these pesky hormones mean that women cannot or have not been historically studied within medical research, because it's a bit annoying that they have these hormones, which is mental.
It is. Yeah. So, I mean, I think if we look at, the more you begin to look at this, the more frightening it is when you realise that most of the studies on most of the medicines that women are going to be prescribed, whether that's during our reproductive life or when we're postmenopausal, have been tested on men, not on women. And so that is across the board for medicine. And that largely is because we are unpredictable study candidates because of our hormones and hormonal change, and also because we have the potential to get pregnant. And obviously testing drugs on women who might get pregnant, not very sensible. But then you take menopause and it falls off a cliff even further. We just don't have the research. So again, I think on social media, you can either read, that HRT, every woman needs to be on it. It should be in the water. It's the elixir of life. It's going to stop you from getting any possible disease. And then heaven forbid, if you can't take it, you feel like you've missed out on this thing that's going to keep you well. Or you've got someone telling you, oh gosh, heaven forbid,
it's poison.
You mess with nature.
Yeah.
The truth for you is to understand it as an individual and to say, is there enough benefit for me, either in terms of of how I am feeling? We get one life, 10, 15 years of hormonal change, feeling absolutely rubbish is not something we have to put up with. It is absolutely okay to take HRT, and modern HRT is in fact very low risk for other things. We haven't got blood clot risk, we haven't, there's lots of people who can take HRT. For some women, they have a very strong family history of osteoporosis. They may have a really strong family history of cardiac disease. Again, for them, that may be something that is a real benefit. But for most of us, the most important thing for us to know is that our bodies physiologically change when our ovaries stop working. Without estrogen, our bodies lose its protection. So we have to work harder to look after ourselves. Can't get away with what we did in our 30s. So that's why, and as you were going through your gut questionnaire, it is so important that we prioritise how we eat. It's so important that we prioritise moving our body. But it is so easy to forget those two really important things, which is prioritising rest and sleep and prioritising stress. Prioritising relaxation and dealing with stress.
Dealing with stress, yeah.
Because that is what's going to keep our bodies well.
Things change. So exercise. Obviously, I used to play a lot of sport,
Yep.
do a
What
lot of
sport did you
cardio.
play?
I played hockey. I played for the Surrey Ladies
Did
League.
you?
I did. I was captain of the Bank of England Ladies First
Yes,
11.
yes, she was.
I
There you
was.
go.
And I miss it. I love team sport.
Yes.
And I find going to the gym the most boring thing in the world. So I now have to employ a PT.
Yeah.
Otherwise
For someone
I
to
wouldn't do
chat
it.
to.
And you're after the drink, so you really need to find some sort of joy somewhere.
Exactly. But also, interestingly, obviously, before it was cardio sport, team
Yeah.
sport. I still play tennis. But now it's very much weights based because that, of course, again, staves off osteoporosis, doesn't it?
Yeah, so I mean, we know that the most important thing when we're looking at exercise for health is to have a base of good cardiovascular fitness.
Yeah.
So actually, just being active in everyday life, walking rather than the stairs, trying to get your 10,000 steps, the equivalent, that is the most important thing all of us can do.
Yeah.
Half an hour of activity a day. Then, and particularly for women post-menopause, weight-bearing exercise is important because we need to maintain our muscle strength if we want to be able to get up off a chair, get up off the loo, live independently, open a jar by ourselves, all of those things that are about our quality of life, not just our quantity. And also to protect our bones and bone density because we don't want to be living our best life, fall over in the garden when we're 80 and fracture our hip, or have horrible back pain because of fractured vertebrae in our back. Weight-bearing exercise is brilliant for our bones and muscles. And yes, that absolutely can be lifting weights, but it can also be digging in the garden, picking up your grandchildren, carrying your shopping.
Yeah.
I am a massive
Chunks.
fan of those things we do in everyday life. They are actually our natural movements. I'm also a big fan of, if you look at all of the studies about what are the keys to longevity, community.
Yeah.
So anything that gets you out there. So yes, probably we do have to be, vigorous team sports and the ability for injury, maybe, but getting out and going to a class, those things that make you part of a community.
Sorry,
I
my
can't hear
stomach
it.
is.
I can hear
I'm
it as
so
well.
What have you
sorry.
had to eat today?
Nothing.
haven't
You
had
see,
any, that's
intermittent
why.
fasting.
Yeah.
You see what I
Well,
was
you see,
Yeah.
now that's
Fasting.
another interesting thing.
Yes. Yeah.
So what I would say is, when you're postmenopause, fasting can absolutely be your friend. I see many women in perimenopause who, again, have put on a bit of weight or trying to feel well or trying to cope with symptoms, and they'll go, "All right, somebody told me that I've got to fast, I've got to lift weights, I've got to fast, I've got to do these things," like this whole tick list of everything we've got to be doing alongside our busy, busy life. When you're going through hormonal change, it is already a time of massive stress for your body. Adding in fasting can be that stress your body doesn't want, and it can produce more cortisol and do the exact opposite. Particularly if you don't sleep, actually fasting may not be your friend, because your body doesn't want lots of cortisol. You want to be promoting lots and lots of relaxation hormones. So I recommend to my women a 12-hour overnight fast and having 5 hours in between each meal. So you've got 2 mini fasts and 1 longer fast.
Oh, that's
that one
interesting.
before.
Oh, I might try
Someone
that.
get Hilary yogurt pronto.
Yeah, get me an Activia.
Yeah.
But it's about learning about what works for your
yeah.
body,
Yeah.
not what works for somebody else on Instagram.
And that's like, it's like Lisa and I are sort of the prime example of it. It's like exactly the same DNA and just entirely different from, you know, I like fasting, Lisa doesn't. The way we exercise is completely opposite. The way we parent, the way we gave birth, the way we were pregnant. It's just like we couldn't be any opposite, and yet we have exactly the same
You
DNA.
are a study in yourselves.
Yes, we
are.
I like it. Yeah.
The interesting, because I actually, when I was breastfeeding, had really sore joints. Would that be because?
Yeah. So breastfeeding is, for most women, it's a very similar hormonal state to menopause.
Yeah,
so
I was getting sweats, brain fog.
So the breastfeeding hormones suppress your ovarian function, so you get low estrogen. So lots of women will get night sweats, they get muscle and joint pain, they may get really bad migraines, may feel very much emotionally all over the place.
Oh yeah.
So yes,
I can
very very
testify.
similar.
And I actually got polycystic ovaries after my first baby, which I didn't notice until, fortunately, I had a miscarriage, and she was looking, she's like, "You don't know you've got polycystic ovaries." And I was
Which
like,
you
"No, I
haven't
didn't."
had before.
No.
I mean, I think that's interesting on ultrasound to be diagnosed with polycystic ovaries, because it's very common for us to see, when you look at it on ultrasound, it essentially you're just seeing lots of
follicles.
ovarian activity. And it's like lots of kind of over-keen follicles going, and me, and me, and me, and me. And that's very common in teenage years, as the ovaries are kind of warming up and getting used to things, they're a bit overexcited, but also as they are kind of starting to work again after pregnancy. Really, to have polycystic ovarian syndrome, you need some other things as well. So it needs to be affecting your periods. It's a whole metabolic process. So I think, want to kind of not get into the trap of being diagnosed on ultrasound, because that may have just been your ovaries.
Come on,
recovering
give us
from,
another baby.
Yeah.
Come on.
Yeah.
Have you what, Hilary? I was thinking there, like, what have you noticed? The biggest, obviously, seeing your grandchildren and their mums, the biggest change for women and in women over the course, because being a doula as well, you'll have seen so much.
Well, I've seen parenting styles change, that's for sure.
What we're all paranoid
softies now.
Well,
helicopters.
yes, it's all very child-led. Yes, like, would you like to put your shoes on? Why are you asking? You just tell
That's
them
what my
they're
mum
putting
says.
their
Just
shoes
get
on.
that girl told. She walks all over you, Lana.
Yeah, and do not say, which shoes would you like to put on? Just present them with a pair of shoes and say, right, we're putting shoes on now because we're going to nursery, rather than having a 20-minute discussion and then a tantrum because they want to wear Wellington boots. So I find that quite challenging, because I was very much of the, right, we're off now. Yeah, exactly. But I think the pressure on you young mums is overwhelming. I watch my daughter-in-law, I watch my daughter and my other daughter-in-law, who hasn't had children yet but is definitely wanting to get onto that as soon as possible. Having it all, it's a myth. You can't have it all.
And I think that's what I also see in perimenopause, is that thing where we expect ourselves to be super women.
Yeah.
When we kind of go, we should be able to be dealing with either the hormonal fluctuations of pregnancy and being a young mum and the tiredness, or the hormonal fluctuations as our periods are stopping, and be doing our senior jobs and be being a perfect wife and having a perfect house. And and often social media is what makes us think that, and we forget that people put their best selves forward,
Yes,
don't
it's
they?
the Instagram life. It's not real life.
And I am lucky enough to see real women coming to me and actually going, this is bloody hard, isn't it?
It is.
And sometimes all we need to do is to acknowledge, this is bloody hard.
Yeah.
And
Life
dealing with
is
the the constantly dealing with the hormone fluctuations. Like Alana took, I think, 3 days maternity. She was literally in a board meeting, puce, the baby hanging off her boob, and I took 4 weeks, I think. And even then, that's because I was in and out of hospital. I mean, you're expected to come back with the mental agility that you had, and you feel like someone has taken all of your skin off, and you feel so vulnerable, and you should feel the most empowered that you've ever felt in your life because you've given
Produced
birth and produced
a new
a
life.
human.
But
You feel my
that's the
confidence went
pressure.
literally on the floor.
Yeah, it's also, I've got to keep this thing alive. I've got no handbook for it, and they're all different. I mean, one of the examples I'm sure Molly won't mind me saying this is my daughter, because we've talked about it on another podcast. I found breastfeeding very easy. I loved it. I'm lazy. I didn't want to do all that sterilising of bottles and all that malarkey. As far as I was concerned, it was the right temperature and the right mix. Game over. So I breastfed, and I breastfed Jack for 6 months, Molly for 9 months, Barney for 9 months. I mean, I loved it. Molly was determined to breastfeed, and I remember I used to go around and stay overnight with her just to help her out at the beginning. And we got to about 6 weeks, and she was sitting in the rocking chair, and I was staying the night with her so that Toby could have some sleep. And she looked at me, and she looked so sad. And I said, "Are you okay, Mol?" She said, "No." I said, "I hate this. I absolutely hate it." I said, "If you hate it, Mol, give it up." "Yeah, but you breastfed, and you're going to be so disappointed." I said, "You're not me. You're you, and I want a happy mum because that's what's going to help the baby. If you don't like it, don't do it.
Absolutely.
It doesn't matter."
Absolutely.
And she said, "Well, I'll plough on for a bit longer." And I said, "Well, I'm giving you permission, Mol, at any point to give it up, and I'm not judging you in any way. What's right for you is what's right for you."
And isn't that permission is such
That's
an
what I was going to
important
say. That's the
God.
word permission.
Yes, as a doula, that's
Because
all I did.
Yeah, because the expectation that I basically got a cyst that then exploded, and I was in hospital having it drained every 2 days, and kept breastfeeding him. But I was in hospital for like 6 days. They said you can't have a midwife in this unit because it's not you're not in pediatric care. So my husband had to fly to America for work. I had a cannula in here. Alana came to get me, and I couldn't.
And I was like,
literally
she was
couldn't
like
do the baby.
sobbing.
There was
and I
like,
was like, just
there was
it's
blood
fine, you
and
don't
pus
need to do
going
this
onto his
anymore.
face, and he was like,
It's time to
"Oh, there's blood and
stop."
pus." And I ended up doing it 10 months, but
Yeah.
because I'd fought for it so much, I have a hole that's bigger than my nipple here. Why?
I know.
Yeah.
And,
Like,
and,
why?
and
What
this
were you
notion,
thinking?
I get that we have to deal in the maternity services, we have to catch all, which means that the advice has to be what it is, which is breast is best. We know it's best, we're intelligent women, but it's not always possible. So this notion that they will not allow formula into delivery suites. Sorry, that's my style.
Listen, Hilary, if there's any podcast that's more than acceptable on it,
Yeah,
this
exactly.
This one. This notion that you cannot have formula in delivery rooms is ridiculous.
Yeah.
It's not poison.
I know.
And some people don't want to feed, which is their choice and absolutely their right. Some people can't feed. Some babies can't feed. You put your finger in their mouth, they can't suck. They're never going to get the milk out of a breast.
Yeah.
So we have to just relax about this.
And I think that this is what you're talking about with breastfeeding is really similar to when we're thinking about, perimenopausal women. It's that treating them as an individual, treating the woman and the baby with kindness, putting actually the top priority on happiness and wellness, not on kind of perceived ideas.
Yeah.
And so, I think at menopause, lots of people will go, well, how do you, what do you do to help? What do you do to make someone feel better? And actually, I think it's the same when you're dealing with women throughout their reproductive life, is that, our physiology is very powerful and we can't really cheat it. So sometimes, whether it is breastfeeding, whether it is when you are, when you're postnatal or when you're perimenopausal, you may do and say and act differently than your rational brain is telling you. And actually, it can be quite difficult. You can be quite a difficult person. But rather than react, rather than with whether it is in the workplace or with your partner or with your child, rather than kind of like, oh, for goodness sake, why are you being so irritable? Why are you being like this? If we can treat others with kindness, if we can take just a second to go, hang on a second, what's going on with you? And again, sometimes wordless, because I think people will often say to me, should I go and say to somebody, is it your hormones? Do you think you're menopausal?
Yeah.
Like, no, that's how you get punched.
Yeah.
But are you all right? Would you like a cup of tea?
Yeah.
Rather than
Yeah.
just that react. That's what personally I think we need to do
Yeah.
in all of these situations.
Yeah.
Yeah, because it's like that balance between, if you say, God, it's my hormones or whatever, it's like the whiny women.
Yes.
You know?
Yeah.
And you're like, I
Yeah.
don't know how we get past that, because
Yeah.
it's so real for us.
And it
But
is
how do
real.
we-
It is real.
It's the throwing up of the eyes that you get from people, isn't it? It's that, oh God, she's off again.
Yeah.
It's like,
She's on her
I
period.
love, someone, a patient once said to me, she was Australian, and she was like, you're all so bloody British about this. So I'm not trying to do the accent, but she basically said, you either try and pretend it's not happening, or you stiff up a lip, or if all else fails, you make a joke out of it.
Yeah.
And I was like, how perfect is that? That is what we do.
that's what we do on everything.
On everything.
Yeah.
And that's okay. But, you know, a woman with brain fog, when you can't find a word and someone is either trying to step in and put that word there for you or make a joke about it, that is just the worst thing. Just allowing a woman a pause so that word will come,
take a
or
breath.
another word will come. Because I see women giving up work, feeling like they are useless, feeling like their brain doesn't work. Their brain still works. They have so much to give. They just can't find the right word. It's just a word finding
Give
problem.
them some bloody time.
Yeah.
It's very frustrating, isn't it? Because women are notoriously brilliant at multitasking. And when you lose that ability, albeit temporarily, it's annoying, isn't it?
Really annoying.
Yeah.
And I think we're allowed to also go, this is a bit annoying. And this is a time where, you know, as I say, like we've got 10 tabs open on our computer. We've got less bandwidth for other things. And sometimes I think we have to be sensible with ourselves about that. So, you know, deciding that you are going to, I don't know, do a degree at the same time as you're going through perimenopause and a job, and you've got elderly parents, and you're kind of going like, well, why am I not coping with all of this? Actually, sometimes it's treating ourselves with kindness too, and just understanding that we can't cheat our way through this phase. Our bodies are going through a major transition. And in fact, whilst the symptoms are horrible, they are telling us something. They're telling us our bodies are changing. And we can choose to lean into that and to listen to our bodies a bit, very much as when your hormones are working well in your reproductive life in that week before your period, when you just want to snuggle up on the sofa. Your body is telling you, hormonally, that's the right thing to do. Give it another week and you'll feel like going out again. It's all fine. Kind of, we need to learn to live with ourselves a bit more, I think.
Yeah. Well, we're back to the village, because, of course, if you were living in a community with a lot of women in it, then we'd all be doing that.
Yeah, we were talking about this before, like the craving for matriarchal figures around you. Like when you're going through hormone changes, but particularly when you're about to have a baby or once you've had a baby. Like I just wanted my mum and amazing, brilliant, capable women around me.
Yeah.
Because I was like, you get it?
Yeah.
It's like that unspoken, you're going to be fine.
And some of it's advice, but again, some of it is that very precious thing, which is permission. I think it's feeling held and listened to and being given permission that what you are doing, whatever it is okay.
Yeah. I've had two friends recently who've had babies who've both lost their mothers, one quite recently and one much further back. But they've both gone through a grief process again. Having had a baby, their first baby, that's when you think,
Because you need your
I
mum.
want my mum. Because I want to know how she was with me as well. It's a very personal
Or I
thing.
think you need the mum that you think you should have had.
Yeah.
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 Because I think that can be the other
Yeah.
thing as well, because sometimes your mum just can't be there.
Yeah.
Yeah.
Oh, very
Interesting.
deep.
Oh,
very
we've got very
deep.
serious. I've got lots of jokes like
Actually, we're going to get onto that because, Hilary, I know that you have done a few crazy, wacky diets in your lifetime.
have,
And we have a
yes.
section on the show called Full of Shit,
Yes.
which is we ask our wonderful experts to debunk myths
Okay.
and like nonsense diets, basically.
Okay.
Do you want to get your list up?
Well, there's
and
one
see
I
if you
would
can-
like to ask.
Yeah,
It's
yeah.
this is a big, again, cultural shift dietarily. When I was growing up, my mother, who was permanently on a diet and permanently off to Slim as Well or Weight Watchers or all these ridiculous diets, it was all do not go near carbs.
Yeah.
No, sorry, it was all do not go near fat.
Yeah.
It was fat was the energy, no fats, fat. So they're all ploughing into bread and everything. But
Yeah.
it was carbs were fine, no fat. Now, of
Yeah.
course, we've had a complete shift.
Yeah.
And it's no carbs, but fats are good.
Yeah.
So what's right?
So I think for all of if there was one like perfect diet or way to lose weight,
Yeah.
we would all know about it, wouldn't it? We
would.
would all be doing it.
Yeah.
I think it's easy to say that there's no evidence out there as to what works. There's lots of evidence to what doesn't work, but actually there is a lot of evidence and consensus about what does work, and it is the things that our grandparents taught us. So essentially, a Mediterranean diet is what we want, and a Mediterranean diet is where you eat all food groups. Each food group has a really important role to play. If you try and kind of cheat your body by eating only one thing and not taking another thing, one, you risk not giving your body adequate nutrition. But two, in this day and age, we often do it by using kind of foods that we've bought because we think they're going to be good for us. Most of those foods are ultra processed. We know that ultra processing and the chemicals are absolutely rubbish for our gut microbiome. We know our gut microbiome is pivotal for our weight management. So I think lots of the things we've been kind of sold or told to do and sort of do the exact opposite. I think the other thing that happens is that one person will find something that works for them,
Yeah.
and they want to share the good news.
Yeah.
But what works for them and their metabolism may not work for you and your metabolism. So the biggest advice I can give to people is if you've tried something and it isn't working for you, stop
something
it.
else, yeah.
Like, because again, I see lots of people who are, I've been told I ought to fast, I shouldn't eat carbs, I've been told, and they keep on doing all of those things and nothing's working, but they still keep on doing them, and then they end up eating less and less and less and less and less, cupboard full of supplements. Real food, 3 meals a day. Try not to snack, and if you do snack on protein kind of rich food because it's going to keep you full to the next meal. You need to have all the food groups. You need carbohydrates for your energy, for your brain, for long-term sustained energy. Ideally, you want them to be whole grain because they break down more quickly, so they're going to give you a kind of nicer runoff of energy. You absolutely need fats because they make you full and stop you from overeating, but there are also really important vitamins that you can only get from fat-containing foods. Probably want to watch the saturated fat, but natural fats and plant-based fats, really, really important. So Mediterranean diet, oily fish, olive oils.
Yeah, fish fan.
We love oily fish, yes.
Yeah. What would you go? What's your go-to?
My go-to, there's a really, really good company in Hampshire called Chalkstream that do trout. Oh my God, their smoked
Do you know them
fish
as
is
well?
Yeah.
What's this trend that we're not on?
Oh, we
Honestly,
love it.
my
Look
daughter
it
went
up.
into Tesco the other day and picked up, she's done it twice now, so I actually brought them there. She picked up a tin of sardines, was like, I want these, Mummy. I was
well,
like,
Can I just say, Mr. Whitehall and I love a tinned fish as well.
oh,
Yeah.
so
We
good
just
for
have
you.
what would you
And
do with
those
that? It's on toast.
Yeah, nice. Or you
And
can
a
make it into a
menopausal
platter with a
woman,
bit of cream cheese.
The bones, small bones in fish,
Yeah.
particularly if you're not liking, because lots of us will have decided that we either can't tolerate dairy or feel like you can't have dairy. Dairy is so important for calcium. If you can't have dairy, tinned fish, because you've got the little bones,
Yeah.
massively great
Salad.
source
Make a
of
fish cake
calcium.
out of it as well. I make a fish
But
cake
just
with
on
tinned.
toast.
Yeah.
Pilchards on toast, yum.
Yeah, I
Bit of
made
vinegar.
some fish cakes with tinned mackerel the other day and mashed potato, lots of herbs, put it in a breadcrumb crust.
I'll come round to your house, Hilary, for some fat.
You're very welcome. But at Chalkstream in Hampshire, I can't recommend it highly enough because they do lots of smoked fish and cured fish. They do trout fillets, which if you've ever seen those streams in Hampshire, they're clear. They're beautiful. And
They've
trout.
come from the best house.
Yes.
They
And
come from the
that's
best
good.
house.
Full of omega-3, which
Yeah.
of course we
Yes.
all want to be eating because we all need that for our brain health and also for our hormonal health.
Right, Hilary, the other thing we do is ask people if they have any, which I think that you are going to have, any toilet-related
I know.
/ poo anecdotes.
I cannot believe I'm even going to tell you this anecdote. And I
best
cannot,
kind.
cannot identify whose it was, and I cannot believe I actually did it. But we were in a situation where a floater was involved, not mine, and I was not able to leave it there for various reasons, because we were actually, I'll tell you what it was. We were actually looking around a house that we were thinking of buying. And I thought, I cannot leave this there. So I
Boys always
picked
need
it
to have
out.
poos.
Yeah, I picked it out, wrapped it up. Yes.
hand.
Well, no, I picked it up with the loo roll. It's a bit soggy,
Put it
but
in your handbag.
I then had to put it in my handbag.
No!
Yes. No. Then, of course, what do you do with it? I put it in a nearby litter bin. I hasten to add that we did end up buying the house.
So you got it in the end.
I got it in the end, but I thought I cannot leave this there because it was in the ensuite of the master bedroom.
I love the boldness of whoever it was in your family that was just like, do you know what?
It
It
wasn't boldness, it was desperate.
It was desperation. Okay.
Which was,
The motherly sacrifice.
oh my
Or
God.
wife.
Do you know what? What a fantastic end to this podcast, because I feel like that sums up women.
Motherhood.
Yes.
Perfectly.
Motherhood, wifehood.
You're willing to put
yeah.
a child / your husband's poo in your own handbag out of somewhere.
Your words, not mine.
Honestly, gold.
Jack once left a floater in a restaurant in Spain, and he then thought, okay, I'm going to have to deal with this because he kept flushing it, it wouldn't go. So he went out to get one of the waiters. He's told this in a stand-up, so I'm not divulging anything that he hasn't put out there. He went out, got the waiter, and sort of managed to with sign language and everything, because he doesn't speak Spanish, to get the waiter to come in to the loo to say there's an issue. And he was pointing at the floater and saying, problemo, all of that. He then pulled the flush, at which point it disappeared. So it was like he got the waiter in there.
Just to show the
Prize.
prize.
Show the prize.
Look what I can do.
I feel like we need a whole other episode with the Whitehalls and their toilet dramas, because they're
Floaters.
Yeah, floaters.
Floaters are us. Yeah.
Fibre.
Yes,
Yeah.
exactly.
Yeah.
Exactly.
That's your home cooked meals, Hilary.
Yes, exactly.
Yeah.
Exactly.
Thank you both so much for coming on. You've made me feel
Thank
better,
you.
warmer, more whole as a
Oh,
woman.
bless.
So,
And I'll be there when that baby
Oh, yeah,
arrives.
December.
I'll be there.
You're getting a phone call.
Dula Hills.
Yeah.
Will be there.
Did this gut you excited? Join our 100 Days to Hack Your Gut Health programme. The link is in the bio. Come and find us over on Instagram too, at The Gut Stuff. Pretty simple. Thank you again to our guests and our sponsor Activia. Hit subscribe. Your gut will thank you for it.